Welcome, I'm Gary Phillips, Mayor of San Rafael, and I'm honored to address you. I would like to bring you up to date on the community's preparation to address the current outbreak of coronavirus, often referred to as COVID-19. As you're undoubtedly aware, cities across the country and literally around the world are facing this life-threatening virus. But what concerns many of you is how well is San Rafael prepared. I can tell you much has been done to address this matter. But to be specific in particular areas, I've decided to bring several knowledgeable individuals who will provide us a comprehensive set of facts on San Rafael's actual readiness. So I've asked three friends to join me in this effort. They are Damon Connolly, Marin County Supervisor, whose district covers most of San Rafael, Pat Kendall of Kaiser Permanente, and Jim Schutz, San Rafael City Manager. The county, through its Health and Human Services Department, has taken an active role in preparing our Marin County community in areas that Damon will review for us. I greatly appreciate Damon's active participation in these efforts. Many of you know Pat Kendall. In 2013, she was selected as the San Rafael Citizen of the Year, and for 18 years, she has been the medical group administrator of the Kaiser Permanente San Rafael Medical Center. She and Dr. Kumar will address the status of preparation by San Rafael's Kaiser and some of our local hospitals. Jim Schutz has had my complete trust as our city manager for over 8 years. Jim has been working a long number of hours with our staff members day and night since the outset of this virus, overseeing our Emergency Operations Center. He will talk to us about the status of our public safety and generally the status of our key San Rafael city services. So we'll cover the county's efforts, status of our hospitals, essential city services, and I'll follow up to what we're doing to assist our San Rafael small businesses. Damon, let's hear from you.
Thank you, Mr. Mayor, and thank you very much for your partnership. As you can well imagine, the county is primarily focused on the public health of our residents and making sure that everyone is protected and safe and following the shelter-in-place public health order in order for us all to get through this successfully together. I really want to start by thanking all of our frontline healthcare workers, continuing to make sure that we're doing the right testing. I had an opportunity to visit the testing site yesterday, and special thanks to a lot of volunteer nurses even who are stepping up and nursing students from the College of Marin. We have a great team through Marin Health and Human Services, led by Dr. Matt Willis and Dr. Lisa Santora, who are really on the front lines with our HHS staff. I want to assure residents that we are making all the necessary arrangements with hospitals, with regional partners, with our cities and towns to ensure that we have the resources in place as we anticipate a surge in cases. So those have been plans that have existed for some time, disaster readiness, and they're being tailored toward this particular crisis. We have an outstanding Emergency Operations Center. And again, thank you to the City of San Rafael that's been a great partner on that as well. Above all, though, the message is we all have to continue to do our part, practicing good hygiene, maintaining physical distance, staying home as much as possible, except for essential trips. As was stated recently, we're only as strong as everyone following the guidelines, so we can flatten the curve. So I want to also mention that we recognize that a lot of people are facing hardship because of these necessary actions. The financial impacts are broad. The closure of schools in particular for many of us feels unreal right now. The impacts on our teachers, our children, and our families. And really want to mention that our teachers are doing an incredible job in fulfilling their responsibilities for remote learning. So a few things that the county has done. One is to establish a COVID-19 relief fund in partnership with the Marin Community Foundation. That is $1 million and is going toward the needs of some of our most vulnerable residents, including for things like rental assistance, providing broadband access in underserved communities. We've established an eviction moratorium, which covers both commercial and residential leases through May 31st. We're concentrating a lot of effort on our homeless population and making sure that they're sheltered during this crisis period. And as the mayor mentioned, a huge emphasis, including one of my personal priorities, is to protect our small businesses and their employees. The mayor will be talking a little bit more about what we're doing together on that for San Rafael. But I think it's also important for residents to tie into available federal and state resources. Some great resources for that are through our Marin Small Business Development Center, as well as the Small Business Administration. Parks and open space is a big issue. And again, we appreciate folks striking the right balance between get out with family members, your pets, take a walk, go to your local open space, but please refrain from hopping in your car, going to a remote location or beaches or some of our parks. Those are now off limits. Food resources is a big priority. We're working closely with the San Francisco Marin Food Bank, which has a food locator online for older adults and persons with disabilities. Please call 415-457-INFO, INFO, for resources. One of our top responsibilities is providing the public with accurate, timely, updated information. So I encourage you to sign up for the Marin Health and Human Services daily updates by subscribing to coronavirus.marinhhs.org. You'll find dashboards on testing, hospital capacity, negative tests, and confirmed cases, among other information. So just to conclude, thank you again, everyone, for making the efforts to keep in touch with neighbors, serving in any way you can as we get through this. I'll say on a personal level, one thing that's kept my sanity is every night I'm trying to reach out and call seniors in my district as a way to say hello and keep in touch. And please let me know directly if you know anyone who kind of needs that call or needs assistance. It's all hands on deck, and we're truly going to be stronger together by working together to get through this. So thank you again, Mayor.
Thanks, Damon. Good job, and thanks for the coverage, and thanks for being here today with us. Pat and Dr. Kumar, you're next, and we're looking forward to your presentation on status of our hospitals.
Okay, so good morning, Mayor Phillips and Supervisor Damon Connolly. Thank you so much for your words. I'm going to reiterate some of them, but I think that only underscores that both from the leadership of our community and of the hospitals, we share the same message. And Jim, I look forward to hearing what you have to say. So to the wonderful city of San Rafael and the community of Marin, we're very happy to be here. I am, as the mayor said, Pat Kendall, and I'm here with Dr. Naveen Kumar, who is the chief physician at Kaiser Permanente in San Rafael. The two of us are here also as actual San Rafael neighbors, healthcare professionals, and people who are working every day in COVID-19 and are extremely proud, number one, of our partnership throughout the whole community. As Damon said, the County of Marin, the EMS, all the hospitals, and many of the board and cares and skills facilities, we all are really working as one. We're going to share with you the most important things we need for you to know from a medical point of view about COVID. And again, it's going to sound redundant, but maybe it'll be important that we're all going there. First of all, we are very fortunate that we had a governor who jumped in as early as he did to make a law about, or a law or an ordinance about sheltering in place and social distancing. That was the right thing to do then, and it remains the absolute right thing to do now. So how do we know this, and how do we know that it's working? So first I wanted to talk to you about something called doubling time. And doubling time means that on any one day, when we know the total number of positive tests that have come into our community. So let's say that number is 600. So then we pay very close attention when that number jumps to 1,200 or doubles. And we measure the days that it took to double. So right now, we are in Marin County doubling in 8 days. And so how does that compare to the rest of the country? Right now, the rest of the country is doubling in 2 to 3 days. So that means they are increasing at a much faster rate than Marin County. And this is largely and absolutely as a result of sheltering in place and social distancing. So this is important. Why? Because most of the exposure right now is community acquired. It's not from traveling. We're getting it from people in our own community. So what does that mean? I think Damon said it, but I'm going to say it again. So that means staying at home with your same family, not with the neighbors across the street, not inviting your cousins and your grandparents to dinner. That won't work. If it's you and your family, you're like your own petri dish. I am going to add this, though, because I hear people saying things about at home that really aren't true. Our ID specialist, I asked her one day, what do you do when you go home? She said, I go home, I wash my hands, I hug my kids, I eat dinner, and I put them to bed. So the point is that when she goes home, that's what she does because that's her community. Does that make sense? So you can, in your own home, be as natural as you have been before, as long as you're not there with people who are sick or immunocompromised. So you can certainly treat your family like you normally do. And so when you do go out, like Damon says, you should walk 6 feet apart unless you are walking with your family, and then you could walk closer. When you go to the grocers and get medicine and all of that, it's still the same 6 feet apart responsibility. So you can consider also wearing a scarf or a homemade mask when you go out to the store. But please, please, please leave the precious N95 mask for your healthcare workers. I know you've heard the new words of PPD. That is the protective gear that we have for our staffs in the hospitals and for our frontline providers. So we want to make sure they get those, and that we who are out, when we're out in the public, wear the homemade masks or scarves. And then we have to remember the very, very, very fundamentals, and that is to wash your hands, and wash your hands whenever you've gone to do anything. And I think you've heard it already, that sing happy birthday twice, and you'll have your 20 seconds. And the other thing, my most favorite, is don't touch your face, especially your eyes, your nose, and your mouth, because that's where your mucous membranes are, and that's where the virus, how it gets in. And the other thing is wipe down surfaces, the sanitizer, but it's best to use soap and water on your hands only because the sanitizing gel is getting very low. So use soap and water whenever it's available, and we do know that's at home. So I'm going to ask Naveen if he can explain to you other things that are showing us that shelter in place is really one of the most important things to do in social distancing. And plus, he's going to give you a little more facts and talk about what we call the phases of all of this from a medical profession, and that's the containment, the mitigation, and then we're facing the surge. And he'll also talk a little bit about what we're talking about, suppression.
Great. Thank you so much, Pat. I think Pat gave an excellent overview of epidemiology and transmission of this disease. Just to reiterate a little bit about where we've come this journey. So initially, when it was identified, we were in what's called a containment phase, trying to keep the virus localized. And now we're in what we call the mitigation phase. We're trying to keep it from spreading, and all of these things that Pat talked about, all of the measures to flatten the curve, that's incredibly important. And so we can't reiterate that enough. And what I really wanted to talk about now is some of the things that we're doing in preparation. So what are your healthcare partners doing to help prepare? And I want to give you a lot of reassurance. So the first thing is trying to practice social distancing in a medical way. So as you can see, Pat and I are actually sitting 6 feet away from one another. And what we're trying to do is move as much of our care to the virtual arena. So it's what we call virtual care. So we have really shifted to a point where we're able to provide almost 75% of our care through telephone or video, and that's been really incredible, and it prevents people from having to come on campus. We use our mail order pharmacy, and we do as much as we can utilizing the technology that we have. So the first part of surge planning is seeing, okay, how can we contribute to reducing the spread of this infection? And when we think about surge planning, we think about what we call the 3 S's: space, stuff, and staff. And I want to reassure you that we have been, working very diligently on all of these things. And what's really happened, because we flattened that curve, that's given our healthcare system time to prepare. And so we're getting a lot of things in place. We're getting our PPE that Pat talked about. And I really want to thank the community. We've seen just an outpouring of support with donations of masks, et cetera. And we all really appreciate that. So it gives us an opportunity to build up our stores, to order ventilators, all the supplies that we're going to need in the event of the surge. So we're working on our space, we've got our drive-through testing, we've got our evaluation stations, and so we feel very confident and very prepared in tackling this challenge that's ahead of us. And then finally, I want to say we really appreciate the support of the entire community. I just want to say, living here in San Rafael and Terra Linda, there's nothing more wonderful than hearing those 8 o'clock howls that happen. So thank everyone for getting out there and just outpouring of love and support to the healthcare community. We appreciate it all, and we want you to know that we are here to take care of you. We're open and we are prepared.
And we also want to add that, like Damon said, we're really thankful to Matt Willis and Felisa Santoro who are leading the community efforts. We've been in contact with Eric Piper and many of the leaders at Marin Health, and also the leaders at Sutter and Nevada. We're trying to help each other, support each other, learn from each other. I want you to know that you should feel very reassured about what we have done and what we're planning to do. And Naveen did mention the word surge, and we will have a surge. We know that the cases are probably going to go up before they go down, but the fact that we have a high number to start with the doubling down, that gives us an inch on things. So we're actually looking at that as very favorable and a very positive and reassuring number for us. So anyway, that's the most important things that we have, and I know that the mayor is going to be asking at the end of this for questions, and we welcome your questions and we'll provide all the answers that you would like. Thank you.
Well, thank you, Pat and Dr. Kumar. We are very fortunate to live in this community, I must say, and certainly you and your operation is one of those reasons why I would underscore that fact. So thanks so very much for bringing us the words of wisdom. We greatly appreciate not only the words, but certainly your everyday efforts to keep our community in the good condition that it is at this point. So with that, Jim, talk about the City of San Rafael as a city manager. We have, of course, a number of city services. People are probably curious to where we stand on those, public safety, et cetera, and some of the other things that you've been doing.
Great, thanks, Mayor. As the Mayor said, I'm San Rafael City Manager Jim Schutz. I've worked for the city for 13 years. I've been the city manager for about the last 4.5 years. I'm going to start really basic because a lot of people watching may not know how the city might be different from the county government that Supervisor Connolly spoke about. And the county is the level of government that has Health and Human Services and the county public health officer. The city doesn't have these functions, and we're focused on police protection, fire and paramedic response, planning, public works, recreation, those sorts of things. So because of that, it's absolutely crucial that the city has a strong relationship and partnership with the county, our schools, our healthcare partners, nonprofits that are serving vulnerable populations, and others to respond to the community's needs during this time. Fortunately, we all do work very well together, in part as evidenced by this call. The city did a proclamation of local emergency on March 10th, and we've been operating our Emergency Operations Center, or our EOC, since that time, which generally means our organization turns into disaster response instead of normal city business. While the vast majority of our non-safety workforce are now remotely supporting city operations, our police officers and firefighters and paramedics remain fully operational 24/7, providing a high level of service that our community depends on. So we're all familiar with the example of the burning building. As residents are fleeing, first responders are running in to the building to help people. And that very same concept is happening right now. When our population is sheltering in place, our firefighters, paramedics, and police officers are in the streets, keeping things safe, interacting with our most vulnerable populations, responding to emergency calls, and helping wherever they can. And I can't thank them enough, and I know the community feels the same. Our non-safety employees are stepping up in new ways to provide services during this time, and I just want to give a few examples. We have childcare workers who are providing childcare to the children of emergency workers like doctors and nurses. And that was recently expanded to include children of disaster service workers, and now even children of essential businesses and people that are able to continue their business in this time because they've been deemed essential through the county health order. Our maintenance workers, like in public works, are helping deliver meals to St. Vincent's for distribution on a daily basis to people experiencing homelessness. We have economic development staff that's working really closely with our wonderful San Rafael Chamber of Commerce and Business Improvement District. They're providing local businesses with critical information about the various stimulus opportunities and packages and ways that the community can support our local businesses as well. And then we've been continuing to hold city council meetings online in new ways, with new ways for the public to participate, including through YouTube Live and by the telephone. I know a lot of cities are adapting to these changes very quickly, and some are at this point just taking public comment in advance. Right away from the very last city council meeting, our city clerk was able to set it up so that we're taking public comment real time to maintain as much normalcy and transparency as possible given the challenging times. So please feel free to continue to participate through YouTube Live in particular. And then we also have essential services that are going on, like emergency infrastructure repair and maintenance, permitting and inspections for emergency work and essential projects. We're also starting to do video inspections. Our community and library center staff has created a virtual recreation center and an online library that has virtual programming and resources for stay-at-home activities, such as story time, virtual book clubs, and more. We're doing more and more outreach to vulnerable populations and continue to build out our how you can help the neighbor-to-neighbor opportunities. So I'm going to provide more information on that in a second. Our digital team has been working on assisting our employees who are now working remotely and also getting more city services online. We have city staff answering phone calls and responding to questions from the community, as well as processing online permits and licenses. We've been trying to get information out in a lot of different ways to try to keep our community informed. Our police department, for example, has been doing a great job making videos both in English and Spanish, helping to clarify and stress the importance of social distancing. We have signage in English and Spanish at all of our parks and open space. And then we're also trying to provide frequent updates to you through many different channels, through our website, social media, and through your email inbox. So if you're not receiving those regularly from us, we send out a public communication almost every day, or at least every other day. So to stay up to date, if you're not getting those, it's www.cityofsanrafael.org/subscribe in order to sign up for general city news and updates. And everything that I just talked about, from the virtual recreation center, online library, the videos I mentioned, business resources, how to participate in city council meetings, all of that is also in one place at cityosanrafael.org/coronavirus. So I want to add my thanks for the community to continue to shelter in place and only doing essential trips because it does take all of us working together to get through this to flatten the curve. And San Rafael is resilient. And thank you so much for everything that everyone's doing. I'll turn it back to you, Mayor.
Well, thanks, Jim. As you can tell, the city's in in good shape under Jim's direction. So we greatly appreciate that, Jim, and certainly all of the employees that are out there doing their part to make our community all that it can be under these circumstances. So thank you, and thanks to the entire staff for doing so. So I would like to thank the four of you, for participating and providing the status and preparation for the COVID-19 virus, which is affecting all of us, from those that want to use our parks, to our schools and students, to our nonprofits, all of those of us in our daily lives, and of course the many businesses and their employees. So while the well-being of our individuals is most important, so too are the many businesses that we serve and that serve you. As you know, and certainly can imagine, they too have been hit hard by this virus. So to help us with our smaller businesses, we have created a small business, San Rafael Small Business Relief Fund. We will be helping our small businesses in San Rafael, including your restaurants, service providers, retailers, others that have closed or are struggling financially. Together with the San Rafael Chamber of Commerce, the county, the city, and support from businesses like Bank of Marin and some individuals, we have raised about $200,000. We shall make these funds available to our San Rafael businesses for rent, operating costs, employee salaries, for businesses with 25 or fewer employees, with San Rafael sales of $1 million or less that have suffered a reduction of sales of at least 40%. Soon, an application will be available on the city's website as well as the chambers for these funds. We will be making contributions initially of $5,000, that is grants of $5,000, to the extent that funds are available, and we will be seeking additional funding. So we welcome small businesses, our small businesses that are truly the fabric of our community, to apply for these funds so we can help you in these most difficult times. But to close, these are difficult times for everyone across the nation, certainly including San Rafael. But we have an excellent healthcare providers, resilient businesses, excellent public service employees, and a solid community to help everyone get through this difficult period. We shall continue to monitor this situation closely and adjust as necessary. But please continue to abide by the best wisdom and ways to cope with this hideous virus that, thanks to Pat and Dr. Kumar, have outlined, I think, extremely well. We hope this presentation has been helpful to you, and we'll follow up with questions. Please submit them to me, Gary Phillips, at cityofsanrafael.org, and I will address them as soon as possible, along with several other topics that you may have an interest in. And finally, take care and be safe, and thanks for joining us on this presentation.